With March break travel on the horizon, health officials are continuing to urge Canadians to make sure their measles vaccinations are up to date. It comes as the World Health Organization notes an alarming increase in cases in Europe and some concerning cases here at home as well.
So there's been two cases in Canada, one in Ontario and one in Quebec, where the person who was infected had no travel and no known exposures to someone with measles. So that really tells us that there's people walking around who are infected and transmissible to others.
Due to the transmissibility of the airborne virus, Health Canada says 95% of the population needs to be vaccinated to prevent community spread. But the coverage has dropped, and infectious diseases specialist Dr. Isaac Bogosh warns the virus will find unvaccinated and undervaccinated populations.
I think we can't ignore the tremendous disruption that the pandemic had. And many people may have missed just a routine dose of a childhood vaccine for their children.
There may be another issue at play.
The second dose of the measles vaccine was added in 1996. So there's a lot of people out there who have had one dose but not two doses of a measles vaccine who think they're fully vaccinated.
Do you know if you're fully vaccinated against measles?
I don't think I am. No, I don't know. I don't think I am. Should I be? Should I be worried?
I did vaccinated, but I just did the first dose, so I have to do the second one in 4 weeks.
Toronto's Associate Medical Officer of Health is urging people to check their vaccination record card or check with their primary healthcare provider to ensure protection against what she calls one of the trickiest viruses we know.
One of the things that happens is it has a long incubation period. So you could have been in contact with the virus a week ago and not show symptoms until a week later, or even up to 3 weeks later. That's why travel is a really important perspective of measles.
And Toronto's only case so far this year was linked to travel, an infant who had to be hospitalized in February, highlighting another vulnerable population.
The routine schedule for measles is to get a dose of vaccine when you're 1 and a second dose when you're between the ages of 4 and 6. But there's this gap of children who are under 12 months of age who don't have that protection.
That's why ahead of March break, Toronto Public Health is reminding parents of infants that starting at 6 months, they are eligible for their first vaccination if they have travel plans, with that first shot providing 85 to 95% protection. In Toronto, Michelle Mackey, City News.